Have you ever walked out of your clinic at the end of a Tuesday feeling completely drained, even though your patient volume was technically manageable? Most of us have been there at some point, concluding that this exhaustion is simply an inherent part of being a specialist. We attribute it to the weight of clinical responsibility, the complexity of our cases, or the demands of a high-end patient base. However, the reality is often quite different. The primary culprit behind that bone-weary feeling is what I define as invisible waste. This is the friction in our daily routines that silently steals our time, our focus, and our profit without us even noticing the theft in real time. In the framework of lean orthodontics, waste is truly the mother of all evil. It is any activity that consumes our finite resources, whether that is time, mental energy, or capital, without adding a single ounce of actual value to the patient's treatment outcome or their experience in our chair. To transform your practice from a source of stress into a source of pride, you must develop what I call a lean eye. This is a refined mindset that allows you to see beyond the surface of the daily chaos and identify the deep structural inefficiencies that are quietly holding you back from your true potential as a clinical leader and an entrepreneur. One of the most insidious and dangerous forms of waste in any professional dental environment is the negligible delay. We are often conditioned to ignore a 30-second stall because it feels insignificant in the moment. We think to ourselves, what is half a minute in the grand scheme of an 8-hour day? But in a high-volume orthodontic setting, these seconds compound with a speed that is nothing short of staggering. Imagine a typical afternoon block where your team is scheduled to see 50 patients. If an assistant or a doctor takes just 30 seconds longer per patient, perhaps due to a disorganized drawer, a slight delay in changing a wire, or a poorly positioned bracket tray, you have effectively lost 25 minutes of high-value clinical time by the end of that single session. This is the precise reason you miss your lunch break. This is why your afternoon schedule consistently runs late, and why your team leaves the office feeling depleted and stressed. True efficiency is not about rushing through your clinical steps or compromising care. It is about systematically removing the micro-stalls that disrupt the natural flow of your day. As orthodontists, we are trained to be meticulous, but we must be careful that this meticulousness does not morph into intellectual waste. We often find ourselves collecting massive amounts of diagnostic data, tracing dozens of complex cephalometric angles, and recording endless metrics for every single case. But as strategic leaders, we must ask the critical lean question. Does this specific piece of data actually influence my treatment decision? If a piece of information does not change your clinical path or improve the patient's final result, collecting it is simply ballast. It clutters your mind, it slows down your diagnostic process, and it bloats your digital storage. This principle of lean thinking also applies to the final stages of treatment, where over-therapy becomes a common trap for the perfectionist. Striving for a level of micro-perfection that provides no measurable clinical or aesthetic benefit beyond the current stage is a waste of materials, a waste of precious chair time, and a test of the patient's patience. Recognizing the exact moment when the clinical value has been fully delivered is a hallmark of an expert, high-level clinician. Furthermore, physical waste often manifests through a lack of clinical standardization. When every doctor or assistant in a practice has their own individual preference for a set of instruments or specific pliers, it creates a logistical nightmare for the entire team. It leads to excessive inventory stock, cluttered workspaces, and unnecessary confusion during the sterilization cycle. By agreeing on a standardized, highly efficient set of tools, you eliminate the waste of motion entirely. We have all witnessed the search and rescue missions that occur in a busy clinic. The team member who is forced to leave the chair to find a camera, a specific bracket size, or even a pair of gloves. Every time a provider leaves the patient's side, the clinical flow is broken, the doctor is left waiting, and the patient's perception of our professionalism suffers. A lean practice ensures that every single item needed for a procedure is within immediate reach before the appointment ever begins. Developing a lean eye represents a transformative shift in how you perceive your role as a clinic owner. Once you begin to see the friction in your systems, you finally gain the power to remove it. By addressing these small delays, the intellectual data clutter, and the lack of physical organization, you stop running through your day like a reactive manager, and you start operating with the precision of a Swiss clockwork. The ultimate result is not just a more profitable and scalable practice, but a more peaceful and fulfilling professional life for you and your entire team. You shift from a state of constant firefighting to a state of strategic flow, where excellence is the standard and not an exhausting exception. It is about creating an environment that supports your mastery rather than draining your energy. This is how we reclaim our passion for the craft and lead our practices into a future of sustained excellence and operational calm. Thank you for your time, and I'll see you in the next video.